And good afternoon, I'm Mabel Jong, and you're watching the World Healthcare Congress Interview Zone. I'm Mabel Jong. Thank you so much for joining us today. And we're so pleased that this evening we're going to be presenting the inaugural Health Value Awards. And here in the studio right now is Fred Goldstein, who is president of Accountable Health, LLC. Fred, thank you so much for your time today.
It's a pleasure to be here. Thanks so much for having me.
Well, we're so pleased that you're our first guest because your company was one of really the main forces behind the Health Value Awards. Tell me how those came about.
So what we really did is Brian Klepper and Vidar and a few others came together and said, look, we need to begin changing the healthcare system. But what we found is that employers may not be aware that there are these options out there that are companies or organizations that are doing unique work that demonstrate better value, lower costs, et cetera. And so the idea came together, well, perhaps we could recognize these companies through an awards program. And so that was really the genesis for it. And then it was really working up, how would you then have people apply, what would the application look like, and how would they be reviewed? And we went through that whole process, and it's going to be exciting tonight because we're actually going to give the first Health Value Awards to these companies.
And what were some of the main themes and companies you were really looking for to apply for these awards?
We were looking for employers, brokers, vendors, and others who can demonstrate that what they've actually done works. So for certain categories, for example, they had to submit data, and then that data is reviewed and validated to say, yes, you actually did achieve those kinds of results. There's a lot of information out there. A lot of companies put out ads that say, hey, we do this, we do that, but it's really not validated. And the proof's in the pudding. We see healthcare costs continue to go up, quality continues to be a problem, but these are companies that have put together or brokers that are taking unique concepts out that actually bend the trend, bend the curve, save money.
And what were some of the things that really impressed your panels?
Well, there were a number of applications by certain vendors that did programs, say, in a specific area, say musculoskeletal or pharmacy management or eyes surgery or things like that, and there were a lot of them. I don't know who's won, obviously, but there were a number of really interesting approaches in specific niches, and as Brian's talked about a lot of times, these are companies that have focused on an area, brought in the expertise, both clinical and management, and come up with a different way to do it, and that way is built on science and results in better outcomes and better costs.
And what could other companies really learn from the winners of these awards?
What we want companies to get a sense for is that if they are looking, everybody's talking about how do we bend trend, how do we control our healthcare costs? It's become such a major issue for this country, and we're now seeing employer groups like Amazon and the others come to the fore and say, we're going to do something about this. But we've actually identified through this process companies that already are doing these programs, and so what I would tell employers to do is take a look at some of these winners and some of these other companies that have submitted, because there are answers there to the problems they have. And so they should be looking at this, keep up with it, and then maybe go back to their broker, their health plan, and say, how come you're not giving me that?
Okay. And Fred, it's so nice to see you back here. We missed you last year. Yeah. What are some of the conversations and things that you learned here at the World Healthcare Congress? Well,
I think this conference really covers a broad waterfront, which is fantastic. So I have a personal interest in Medicaid. It's got a Medicaid track there. I have an interest in employers. It's got a track on that. It's got tracks on data and analytics, but it's really bringing together the full spectrum of people. And so it's a great opportunity, one, to learn some new ideas, but also to network with leading thinkers and to just catch them in the hallways, et cetera, and get an opportunity to talk with them. So what's really impressed me the most about this, and this year in particular, is the depth of knowledge of the individuals who are coming to speak. They've really brought in world-class folks.
All right. Fred Goldstein, thank you so much for your time today.
Well, fantastic. It's great to see you again. I'll try not to miss next year.
All right.
Thanks.
I'm Mabel Jong. Thanks for watching. Stay tuned.